Now, Swift Justice with Nancy Grace.
Love hurts. 21-year-old Jasmine Keffer says during an argument back in 2008, her ex-husband, 25-year-old Matthew Phillips, kicked her in the left knee. I'm going to go to a special guest joining me today, Dr. Daren Newfield, orthopedic surgeon. Doctor, thank you so much for being with us. You've reviewed all of the evidence. What do you think is wrong with her knee?
Well, I examined the patient. I've reviewed her records. I've also reviewed her operative notes, also her MRI.
Actually looked at her knee?
Yes, yesterday in my orthopedic office.
Okay. What did you learn?
If you don't mind, can I
Please
stay up here and explain it to you?
I only have a JD, not an MD. You know what? I think I'm going to need that chair. You can bring it on out.
Well, there's two things going on here. The question is, first of all, the surgery that she had 2 months ago, and then the injury that she sustained.
I'm not clear about what the surgery was for.
Well, I'm having a difficult time putting the two together as well. When I reviewed her records and examined her yesterday, she's just had surgery slightly less than 2 months ago.
The surgery was just 2 months ago?
It was on August the 4th of this year.
Okay, doctor, let's hear your side.
Well, first of all, this is an x-ray taken yesterday in my office. It's a lateral view, a view from the side. If there's another view from the front, if we could change the images, somewhere here, there's the patella, which is superimposed on the femur. And if I come up here to the teleprompter, I could kind of explain what procedure she had done. It's difficult to see on this picture, but her patella is about right there.
Wait a minute. How did you do that? Miguel, you never told me I could do that.
And so when you ambulate, your kneecap is supposed to move up and down in a straight direction. Certain people, from either the alignment of their leg...
Wait a minute. Mine does that from my ski accident.
It's extremely common in everybody.
And it hurts for about 20 seconds until you jerk it back in place.
Right. So then some people have...
And I have 2 jobs, by the way. Go ahead.
But some people have a tracking problem, so their kneecap glides either out of groove or in the groove. Generally, that's more of a developmental problem, a muscular strength problem. It's not something that usually you would see associated with an injury. She no longer has the problem. She had surgery 2 months ago, and I believe the surgery is going to be successful. It's difficult to examine her because she has a swollen knee right now.
I didn't know that you would have surgery because your kneecap got out of joint.
It's the last resort. You try to treat it non-surgically.
Do you believe her problem came from a kick to the knee?
I believe that she was struck in the knee. They noted that she did have a contusion on the medial side of her knee, a bruise on the inside of her knee. And a week later, she did have an MRI after the kick, which did show some fluid in the front of her knee. The things I have a hard time understanding is she was kicked on the inside, and the MRI showed fluid on the front, but the surgery she had to be fixed is on the side.
Doctor, I've understood everything you've said so far except for one thing. Do you believe a kick caused the ailment for which she had surgery?
No, I do not.
Okay. But you do believe there was a kick?
I believe she was injured.
But you think that over time something else led to the cause of the surgery?
Yes.
Doctor, you have been incredibly illuminating, but have a seat. I may need you again, though. What, if anything, did we learn today? Don't live in the shadows of abuse. Report offenders. Get away, stay away. It takes courage to be strong. I'm Nancy Grace. Thank you for being with us. See you next time on Swift Justice.